talking about going into hospital. For starters, I should mention that we were making the decision about whether to do surgery or not about a year ago, and because my heart was beginning to start enlarging, and so eventually, at a point when it becomes big enough, you begin to get atrial fibrillation, which can't be reversed. And so my cardiologist was saying, look, we're just beginning to see warning signs that something's about to happen. Let's do it now while you're still fit and healthy, and particularly since mitral valve repairs are having a lot of success. And so then also talking to the surgeon, he was saying, okay, we need to do this in the not too distant future, and with a very strong hint, so you've got enough time to, check your medical insurance and make sure it's up to date, of which I did check my health insurance and found out it didn't quite cover cardio problems. Fortunately, living in Australia means that when I upgraded, all I had to do was wait 12 months. I don't know what happens anywhere else in the world, but it was just a 12-month waiting period before I could get this to happen, which we're still, by the sound of it, a good year or two, really difficult to say, but a couple of years away from actually having problems from waiting too long. My thought was I wanted to get this over and done with as fast as possible. One other thing I didn't mention before was that previously I haven't actually had a heartbeat. I've had a heart pulse. Because of the severe regurgitation, instead of my heart going thump, 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 it ends up being a more as blood's rushing back through one of the valves almost into my lungs again, which apparently is not good. Anyway, went to a private hospital on a Wednesday, got to chat with lots of surgery and anaesthetists and all that sort of people. Then, I had a couple of antiseptic washes and got shaved, which was rather awkward. Well, I've had only one or two male nurses. Most of the nurses I've ended up having throughout my entire stay have been young female ones. But as I say, there's no dignity in hospitals, and I got over that pretty quickly. Antiseptic sort of scrub and all that sort of stuff. Then went to sleep, woke up, and got carted off to surgery, where anaesthetist put my put a drip in my arm, and then the rest of the following 8 hours was not known to me, which I'm quite happy about. I was hoping to almost film it, but that wasn't something they were able to do. However, there are some videos I'll try and link to of the surgery itself, the sort of surgery, also known as a Barlow's valve, is what mine what mine was linked to. Once again, there are for like 70-year-old patients, I think was the one I could see. So I'm assuming mine was a little bit different, being a 28-year-old, but still similar sort of process. Either way, I woke up in the ICU about 8 hours after the operation had started, on a breathing device, which at that moment I chose to try and breathe deeply, which the breathing machine didn't really like, because I had to chew down my throat. They told me I should stop doing that, and I was aware enough to sort of let the I don't know, iron lung or whatever it's called just do its thing. But yeah, ended up having drip in my at least one drip in my right arm, needle down my neck, drainage tubes drainage tube. A number of others I've seen to have 3. I only had 1 drainage tube out of my stomach, and a catheter, and of course the tube down my throat. The tube down my throat for breathing got removed relatively quickly after I became conscious. how exactly long that was, I'm not entirely sure. Passage of time is very slow here in the hospital. And yeah, I was just sort of just doped up on drugs, in a bit of pain, particularly when I moved and breathed. But, you know, out of the woods. I think on that first night I did actually ask one of the ICU nurses if I could listen to my heartbeat after she listened to it, and it was quite reassuring to actually hear I did actually have now a normal heartbeat. Even though it was, I think, relatively faint at the time, but it was the first time I've ever actually heard my heart sound like everyone else's, which was quite nice. Cool, I'll talk about the next few days later, I think.